Thank God Corona is kind to kids, relatively, because sanctions aren't. Kids with cancer are dying in Iran from lack of medicine, as mostly adults are dying in their thousands per month from COVID-19. US sanctions are killing people where the coronavirus wouldn't have. Trump's USA tried to blame the pandemic's death toll in Iran on the Iranian government for corruption and incompetence. But that only doubles the sins of the US for both unleashing medical terror on this country and blaming the victim. That's not to say Iran hasn't made its fair share of mistakes, but not much can compare to the toll US sanctions have taken on the economy of this country and hence the fight on COVID-19. To trace where the blame leads to, stay with me, Leila Faramarzi, on Iran Today. To go off on a tangent, the US is one to talk about incompetence, with a president or outgoing president prescribing bleach as a corona cure.
Right, and then I see the disinfectant, where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs, so it'd be interesting to check that.
Whatever incompetence Iran may have displayed, it pales next to that of the US. And Iran is in a quagmire. Maximum pressure economic sanctions cannot not have hit the economy. They have contributed to a drastic currency devaluation and high inflation. But not to tip the scales, let's begin with domestic causes of the disease having peaked in this West Asian state more than in neighboring states. Let's hear it from the dean of a successful hospital in corona care, who also has in his care kids with cancer. That would be Dr. Abolghasemi of Baqiyatullah Hospital.
The reason for the coronavirus spread in Iran was that we couldn't stop the source at the early stages. The best time to stop the virus from spreading was during the Iranian New Year's holidays. We should have taken more stringent measures like the ones in the Eastern Bloc. The model we chose was unfortunately from the West, and you can see how bad the situation they are in. We need to focus on the carriers of the virus. Testing hospitalized patients doesn't help much. Instead, we should go and test those who are healthy carriers and who have been in contact with them, and then give them facilities so that we can isolate them in hotels, provide them with vacant government houses, and use the money raised by charity to assist them.
Dr. Abolghasemi sees sanctions as a blessing as well as a curse. He takes pride in corona-related findings and domestic medicine that were achieved specifically to survive America's maximum pressure campaign. But that does not erase the greater evil.
Handling the coronavirus pandemic is not just a matter of providing medicine, but also a matter directly related to economics. That is, nations that want to control the crisis must have a stronger economy and stronger facilities. And these possibilities have been taken away from us by the West. They do not allow us to sell our oil. They do not allow us to take back the money foreigners owe us. They do not allow us to make our purchase on what we need, all of which have affected our economy.
Dr. Qanei is a lung specialist and on the COVID-19 Studies Committee. You know, the most common grave danger of COVID-19 is the lungs getting severely engaged.
It is true that we are producing diagnostic test kits, but the problem is that the Ministry of Health cannot afford all these kits. I mean, for example, you see some countries that were very strong economically tested one person twice, but we, for example, could test maybe 350 people out of 100,000. So the number of our tests was down because of the financial problems that were imposed on us. This clearly indicates it.
As the coronavirus made it to its first birthday mid-November, it left in its wake the highest number of casualties Iran has yet seen. And from Saturday, the 22nd of November, the nation has gone into a 2-week quarantine to be imposed. The government has announced quarantine of sorts in past, but it is not easy to maintain given the strain Iran's incarcerated economy has already endured. In the earlier days of the outbreak, when no one knew what they were facing, the world contributed to exacerbating the problem.
There were other practical mistakes made that don't necessarily relate to our country, but to the whole world. For example, they thought wearing face masks had no effect on curbing the spread. For a while, they said the transmission takes place through surfaces. And then they said for a while that the patients transmitted the virus, but then they realized that it wasn't entirely true, as they were isolated and everyone avoided them. We know today that most people who are infectious are seemingly healthy. Insufficient work was done on the matter, and not enough is being done now either.
In the earlier days of the outbreak, Iranian doctors boasted their success in improvising to help patients overcome the disease. Dr. Salehi, chief of the infectious diseases section of Imam Khomeini Hospital, has visited us again. This time, he laments losing the most patients ever to corona as a third wave of the virus surges on. Why such fatality with COVID-19? Does it have to do with insufficient government measures or mostly people's non-observance of protocol?
As to why the number of deaths has increased and why the number of critically ill patients is so high, it is certainly due to the high influx of patients into the health system. If we are to assume that, for example, you have the ability to produce 3 TV shows a day, if it grows to 10 programs a day, how much does that impact the quality of your work? The same goes for us. For example, I have the ability to care for 30 patients a day. If this jumps to 90, I can't deal with my patients as carefully as I have to. This has actually happened. The main reason for the decline in the quality of the health system is a sharp increase in the number of patients.
According to official international sources, as of 23rd November 2020, globally, there are about 60 million coronavirus cases, about 1,400,000 deaths, and about 40,800,000 recovered. And in Iran, there are about 855,000 total cases, under 45,000 total deaths, and under 604,000 recovered. Like I said, there's been a surge in cases, and with more cases come more deaths, but also more treated. Treatment remains much the same.
We use antiviral drugs. For example, drugs such as favipiravir, remdesivir, and various other drugs. On the other hand, drugs such as dexamethasone and methylprednisolone are being used and have really helped some patients. But in general, none of these have been miraculous.
First of all, there is really no particular medicine to cure COVID-19, but there are procedures that we prescribe in clinical trials. One of the things we did to treat patients, like plasma therapy, was a project I started at this very hospital, and even the Americans started to adopt plasma therapy 2 or 3 weeks after us. Another important issue in handling COVID-19 patients is our oxygen supply. They even sanctioned us on this and refused to sell us oxygen generators. We started a knowledge-based company ourselves and produced oxygen.
But my question was, can patients get hold of the cure at reasonable prices? Because some hearsay reports paint a dismal picture. In August, the nation was angered by reports contrary to government claims. In April, the Iranian President Hassan Rouhani had said that the government and insurance department would pay 90% of treatment costs for COVID-19, leaving only 10% to citizens. Studies have shown that in private hospitals, the minimum cost of coronavirus treatment reaches 350 million riyals. That's approximately $1,370 by the November 23rd exchange rate of 256,000 riyals to the dollar. They say those costs can go up to 1.5 billion riyals, which is under $5,900, and that is apart from the cost of private nurses and special medication. In public hospitals, on the other hand, treatment for insurance holders is almost free. But without insurance, a patient would have to pay between 50 and 300 million riyals for treatment, which is close to $200 to $1,170.
We have a protocol in the scientific committee that you can prescribe certain drugs to people who are admitted. This is clear, so I will not discuss it. When we treat the patient with a scientific protocol, it costs us about 5 million 2 months, which is affordable. Also, the insurance pays, and the majority of our patients are insured, and we have a bed for them too. However, some private hospitals perform procedure for the patients that have not been approved by the scientific committee, and the patient is willing to pay any amount in such life and death situations.
Helpful medicine aside, the world is now moving towards using a vaccine. Question is, will Iran make its own vaccine soon enough? Because it's among the countries that have been working on it. If not, will Iran be able to place an international order and pay for it? Because we know that even if medicine were totally not under sanctions, banking sanctions have been enough to block Iran's payment channels. Because countries, companies and banks fear that dealing with Iran would expose them to secondary US sanctions.
ایران هر دو فکر رو کرد همین که اگر کشور دیگری
Iran prepared itself for both scenarios. If another country could produce the vaccine sooner, we can buy it until our own vaccine can be prepared. But I'm sure that the vaccine projects that we have been working on in Iran are close to the final stage. We do not have a problem in terms of their effectiveness. Our problem is to prepare them for the mass production and shipping stage to be able to use them for ourselves. Several projects that I know of are underway in Iran and have achieved very good results. I think we will definitely have an Iranian vaccine by next year.
We are expecting the COVID vaccine to be mass-produced pretty soon. Would you say that would be a reliable vaccine, and will Iran be able to place an order? Can we pay for it? Do we have the right channels, access to the right channels to pay for it?
Instead
of vaccines, I think we should focus on more definitive precautions, such as using face masks, washing hands, and social distancing. The unilateral and irrational US sanctions against Iran and some other countries is another reality we need to face. I am optimistic about these political changes that are taking place in the United States. If Mr. Joe Biden takes the power from Donald Trump and becomes the next US president, it seems that, as he has said in his campaign speeches, he is ready to return to the JCPOA. So I hope we can have vaccines in Iran more easily.
Sanctions are an inseparable part of life to Iranians, who have been isolated by Western terms for the past 40 years. But the first hard blow came 10 years ago with nuclear-related economic UN sanctions on this country. In 2015, those were eased and were to be lifted in stages by the JCPOA or nuclear deal in return for Iran limiting its peaceful nuclear program. Iran did so. But come Donald Trump, hopes were shattered for Iran and other parties to the deal. The US unilaterally pulled out and reimposed UN sanctions as US sanctions on Iran. Call it illegal to have the US deny it. Before carrying on with sanctions, let's take a look at other media outlets to see what they've got on offer. For that, I give you Shahrzad.
Hi, my name is Shahrzad Manucheri, and we'll be reviewing the latest update on sanctions and the coronavirus pandemic, the US's blatant disregard for human lives. CBS News takes a look inside Iran's harrowing, sanctions-fueled coronavirus catastrophe. Iran is struggling with the worst coronavirus outbreak in the Middle East. Scientists at Tehran's Pasteur Institute are coordinating the national coronavirus testing efforts. Dr. Mostafa Salehi Vaziri's team managed to ramp up from just 10 tests per day to 30,000. It was an impressive improvement, but not enough to get control of the spiraling epidemic. The main hurdle for the lab hasn't been science, but politics. US-led sanctions have choked off Iran's access to foreign-made chemicals and equipment. Vaziri has been forced to work with what he's got, which is a shortage of virtually everything. Tehran Times reports 75 lawmakers call on Trump administration to ease sanctions on Iran. Democratic lawmakers have urged the President of the United States to show leniency and allow coronavirus aid to be sent to Iran as the White House drew up a plan to step up sanctions on Iran in the remaining weeks of Donald Trump's first term in office. In a letter to Treasury Secretary and Secretary of State this week, Representative Jesus Choi Garcia and Senator Elizabeth Warren, along with 73 other House and Senate Democrats, called on the Trump administration to issue a worldwide temporary general license that would cover testing kits, respirators, and personal protective equipment needed to combat the COVID-19 pandemic, the Foreign Policy magazine reported. The pandemic has laid bare the ways in which our broad application of sanctions is undermining public health systems, imposing sweeping economic penalties that restrict commerce in the material and equipment necessary to respond to the coronavirus, and harming ordinary people, the lawmakers wrote. In an article by the Middle East Eye, we witnessed millions of Iranians at risk as US sanctions choke insulin supplies. A new tranche of sanctions imposed by the US on Iran has exacerbated the insulin shortage crisis in the Islamic Republic and boosted its smuggling, patients and doctors told Middle East Eye. Human rights advocates have warned about the devastating consequences of the latest sanctions on the daily lives of Iranians, including blocking their access to essential drugs and food. According to Farza Peyruyan, the Secretary of the National Academy of Health Economics, there are 4.5 million diabetic patients in Iran, 600,000 of whom need a daily insulin shot. That's all for this segment. We'll see you next week.
Sanctions had already cost Iran about $200 billion in revenues and helped devalue the currency by half in the past 2 years before the virus emerged. And it was mainly down to decimated oil sales. Modern Iran, after all, has traditionally been an oil economy. So the blow by sanctions, oil sanctions even, to the economy in the medium term, and especially while the country is struggling with a worldwide pandemic, should be obvious.
We are an oil-producing country and we need to sell oil. When they created hurdles for selling our oil, we had only one source to take from, which was the foreign exchange reserve fund and the money we owed from abroad. So we did not have growing economy and did not have an economy with enough reserves. Well, to handle the coronavirus outbreak, shutting down the economy is needed. Elsewhere in the world, when they are under total lockdown, the unemployed are backed by insurance and will receive support.
Iran's crude oil sales of 2.5 million barrels per day, the US tried to bring down to zero after pulling out of the JCPOA. That didn't happen, but Iran had to sell by running circles round the US, and that was up to only 300,000 to 400,000 barrels a day on a good day. You said preventative measures such as wearing masks and washing hands were much better. Well, quarantining is one of those measures, isn't it? Why is it that Iran's economy hasn't been able to sustain a systematic, consistent quarantining?
Not only our economy, but also the economies of more developed and strong countries of the world, both in terms of economy and technology, have been unable to bear this. But I do not think we needed a long quarantine period. I think we needed timely quarantine, but not for a long time. We needed to announce lockdowns and eventually lift the restrictions carefully and with planning, just like what we did in April. Back then, Iran managed to rein in on new daily infections by imposing severe restrictions for 2 weeks, taking new cases to less than 100 people a day. But that plan was abandoned shortly after. As a result, unfortunately, we entered the second wave.
Iranian Foreign Minister Mohammad Javad Zarif tweeted that the US had moved from economic terrorism to medical terror by declining to lift the sanctions after the beginning of the outbreak in Iran in mid-February. He urged the international community to stop aiding war crimes by obeying illegal and immoral sanctions. Iran's plea for sanctions to be lifted on humanitarian grounds during the outbreak has gained traction globally. But to the US, where sanctions failed, the outbreak succeeded. And now's the time to deal Iran that fatal blow while it's still down. To make Iran capitulate to US demands, America not only didn't lift sanctions, but it doubled down, enforcing new sanctions, even as it offered Iran aid to combat the pandemic. Iran refused the aid, obviously, because in Iran's view, all the US need do is lift sanctions as provided for in the nuclear deal, in which case Iran would need no aid. It could freely buy ventilators and so forth for coronavirus patients from any country it desired.
ببینید مهمترین نکته‌ای که وجود داره اینه که خب به هر شکل قطعاً
The bottom line is that the tough economic sanctions that the United States has imposed on our people have definitely affected patients. Acquiring pharmaceutical products and various diagnostic equipment, such as diagnostic kits, and radiological devices such as CT scans, MRI machines, and other equipment that need to be purchased from other countries is another important fact. To a large extent, these unilateral and highly inhumane sanctions seem to have seriously harmed our patients as well.
However much Iran may have suffered, the end result shows yet another failed policy on the part of the US.
خب در کوتاه مدت اون به اهداف خودش رسید.
While the US could achieve some of its goals in short term, that is, it saw the impact of sanctions on Iran. But in the long run, this will be to the detriment of both the United States and its allies, because Tehran chose not to trust them in any way, neither in crisis nor in peace, and to base their trust on its only domestic production. All laws, which were generally import-based, are now moving towards supporting domestic production. Their disadvantage is that, in the long run, they will no longer have a country with a population of 80 million as a market for their goods.
By April, Iran was already losing at least 1 million jobs per month. That's right. And economists said the coronavirus would shrink Iran's GDP, gross domestic product, by a third and create at least a $10 billion budget deficit this year. People are suffering because a government lacking resources can't bail out businesses and can't keep up quarantines, because it can't financially support people so that they won't have to go to work. But the country is still standing. And anyone who doesn't believe they can seek corona treatment, just please refer to any of the good doctors and their hospitals which I just introduced on the show. With the third or latest surge of the coronavirus, I have heard of people spending 1 billion riyals on black market drugs and then hospital treatment. Compare that to 300 million riyals, which is the maximum standard more or less in private hospitals. However, my own friends and one friend in each friend group caught the virus had no such experience. They may have not caught the strongest strain, but the treatment is the same and they got hold of enough drugs to get cured. And those who had to pay didn't have to break the bank. Aye, the greater number of patients treated corresponds with the greater number of cases infected and dead. And with overflowing hospitals and mass graves, doctors will be pleading for medical supplies, although they shouldn't have to, as under international law, a country or coalition of states enforcing economic sanctions should consider the impact on the human rights of the affected population, especially regarding their access to goods essential to life, including medicines and food. That's it for today. Thanks for joining us from the whole team. Do watch again at the same times next week and each week after. We look forward to having you and your comments. For now, it's bye.